Hello, I'm Dr. Charu Lata Bansal, Senior Consultant Obs and Gynecologist at Cocoon Hospital, Jaipur. Fibroids are usually non-cancerous tumors in the uterus or outside the uterus. Fibroids are made of muscular or fibrous tissue. They are very common amongst women in childbearing age group. Fibroids are of 4 types. फर्स्ट इज़ इंट्राम्यूरल, यानी कि जो फाइब्रॉइड होता है वो यूट्रस की वॉल के अंदर होता है. सब म्यूकोजल फाइब्रॉइड यानी वो यूट्राइन कैविटी के अंदर जो फाइब्रॉइड होता है उसको सब म्यूकोजल बोला जाता है. फाइब्रॉइड्स कैन ऑल्सो बी सब सेरोजल, यानी जो फाइब्रॉइड का मेन पार्ट है वो यूट्रस की आउटसाइड पर है. फाइब्रॉइड्स कैन ऑल्सो बी पेडंकुलेटेड, दैट मीन्स जो फाइब्रस टिश्यू है वो एक स्टॉक से यूट्रस से कनेक्टेड है. Fibroids are very common amongst women with childbearing age group. They are as common as 1 in 5 to 1 in 3 women during the reproductive years. Usually, most of the time fibroids do not interfere with pregnancy, but yes, depending on the size, the number and the location of fibroids, they can affect pregnancy in various ways. Like fibroids, if are in the inside of the uterus, they may increase the risk of miscarriage. If the fibroids are large, they can predispose a pregnant female to preterm labor. During the second trimester, fibroids can cause pain and cramping. Fibroids की वजह से placental issues like placental abruption हो सकता है. Fibroids की वजह से even baby की position affect हो सकती है. With large fibroids, baby might become breech या फिर उसकी पोजीशन ऑल्टर हो सकती है. सो दीज आर द यूजुअल आउटकम्स दैट कैन हैव इन फीमेल्स हैविंग फाइब्रॉइड्स. Fibroids, if they are very small, they might be asymptomatic, but again depending on the size, number and location, the fibroids may present with few symptoms like pain and pelvic pressure. Because of the fibroids, there might be sometimes bleeding, especially during the first trimester. Due to the pressure symptoms of fibroids, there might be complaints like frequent urination, constipation and constant pelvic pressure in females with fibroids during pregnancy. Fibroids are sometimes diagnosed in pregnant females only with the first sonography. Fibroids may tend to grow in size during pregnancy, so constant monitoring with ultrasound is done in the pregnant females with fibroid. Treatment depends on the symptoms of patient. Fibroids might not always be symptomatic, but if they are symptomatic, the target is to provide symptomatic relief to the patient. For pain, rest and adequate hydration is advised to the patient. Painkillers like acetaminophen can be given to the patients. Fibroids, if are a cause of preterm labor, the symptoms of preterm labor are monitored. If the fibroids are very big in size, the doctor may advise for a fibroid removal surgery after the delivery. It is a very common misconception that fibroids will always lead to a cesarean section if the fibroids are small and at a simple location and not obstructing the birth canal. Vaginal delivery is definitely possible with not much of problems, but if the fibroid is large, is obstructing the birth canal or having an effect on the position of the baby, then patients might end up in cesarean sections as well. After pregnancy, the fibroids need to be monitored. Especially if the patient is planning to get pregnant again, the size of the fibroids is monitored by sonography. Due to the hormone drop after the pregnancy, most of the fibroids might shrink in size, but females who are planning for next pregnancies or are having symptoms, monitoring with ultrasonography is advised by the doctors. If the fibroids are very large and are causing symptoms, then your doctor might advise you to go for a fibroid removal surgery.